infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now this week, March 15 to 21, is National Poison Prevention Week 2020. And we're going to look at some important questions. What is poison control? And what is the role of a poison control center? Well, joining me today to answer these questions and more is Dr. Mazda Shirazi. Dr. Shirazi is an associate professor at the University of Arizona College of Medicine. He is a clinical toxicologist, and he serves as the medical director of the Arizona Poison and Drug Information Center. Dr. Shirazi, welcome to the show, sir.
Thank you.
So let's start out with, what is a poison control center and what are the main roles performed?
Well, I have to take you a little bit back of the history of poison control centers. So, pretty much after World War One, with another pandemic of influenza back then, and then the expansion of modern medicine, chemistry, and resources, we found out that there are lots of chemicals that humans come in contact with, many of them emissions, and some household goods, and others chemicals that one works at the work site or they're exposed to it in their environment. And we pretty much fast find out that some of these are detrimental to human health. So it's in the 1950s that we find the first poison center actually in the U.S., and prior to that in Netherlands actually opens up. And the attempt was to answer clinicians' calls about these chemicals, their side effects, their effects, and their detrimental effects onto a living being such as human beings. And fast, it turned out to be, of course, also concerned about children, because children are exposed to more chemicals. They experience their life and their environment by what we call hand to mouth. So anything that they find, they put in their mouth, whether it's, the dirt on the corner of the room, or a pill that they find, or they find a bottle that has some liquid in it. And the concern became, okay, these are the most vulnerable members of the society. What happens when they drink chlorine, when they drink, drain cleaners, when they take mom's pill or grandma's pill and such? And that poison control centers became information centers for physicians out in our communities, in our hospitals, to tell everybody, okay, this is the chemical, these are the suspected effects, these are the suspected side effects, and this is what we know about them. Another important fact about poison control centers are that early on, lots of these information was kept on cards, similar to the your 3x5 cards that are used, and the information was either typed or handwritten on it. And poison centers from various areas of country, they would emphasize or specialize on certain types of chemicals, plants, envenoming or envenomation by snakes and scorpions. Somebody else knew they were close to a certain chemical plant, they would work on that. Somebody knew heavy metals, they would, and then the poison centers started exchanging these cards and creating a database for information to help clinicians.
So how many poison control centers are there in the United States?
Well, currently we are, I think, 54 poison control centers. The numbers actually have been in decline. Early days, there was, at one point, there were over, I believe, 500 poison control centers because there was no accreditation body, and pretty much any hospital, any clinic, any organization could declare themselves as a poison control center. I recall that one of our deans at the University of Arizona College of Medicine, he remembered that when he was in Harvard and he was a resident, he was told to answer a phone if it rang and to answer whatever questions people had. Well, one day when he was working in that emergency department as a second-year resident, he had a poisoning, and he went to another phone and he called the poison control number that he had. And he fast realized that the number that was calling was exactly that phone that he was told to pick it up and answer calls. So again, in the past, there was no regulation in training in who was the medical backup, who was answering calls, the database, and such. Excuse me. Nowadays, people that answer calls are either physicians, nurses, or pharmacists. Most places they have nurses. Second group are pharmacists. And some poison centers have actually physicians answering calls. And they are not only trained as either pharmacists, nurses, or physicians in their field, but they do about 2,000 hours of extra training in what we call poison information. And they are backed up 24/7 by a group of medical toxicologists or clinical toxicologists who oversee the quality, the algorithms used, the go over questions. And sometimes when hospitals and physicians call, they want specific information about types of care, and physicians get on phone to help other physicians, emergency departments, ICUs, clinics, for care of a poison or exposure patient.
So poison control is really a very broad topic. It ranges from ingestion of medicines found around the house to ingestion of a poisonous mushroom found outside. Dr. Shirazi, can you discuss some of the poisoning issues that are most commonly reported to a poison control center? And if you know off the top of your head, of all the millions of calls that you get, what's the number one reason?
Well, number one reason is usually the household chemicals and goods. These are cleaning supplies that are at home or other chemicals that are home. And usually, and still to this day, about 50% of all the calls received at poison centers are about children getting into chemicals, and usually household chemicals. Now, when it is correct what you said, that poison control centers now, they do much more. We used to be poison control. Now we are called poison and drug information centers. In the age of COVID and Zika virus and Ebola, we also have come what we call ourselves disease information centers. Because we have an infrastructure that is run by healthcare professionals, and they have quality backup, we have access to database and our own electronic medical records. Lots of cities, counties, states depend on their poison information centers for a variety of topics, whether it's drug, whether it's poisoning, whether it's snake bites, whether it's radiation, whether it's hazardous materials, preparedness, and such. And most poison control centers now, they meet the basic requirements that's required by our national organization for accreditation and go beyond that, such as training in radiation and radiation exposure, such as training with hazardous material and occupational exposures, such as training in medication evaluation and medication reconciliation, especially for the geriatric population. And then, of course, also answering calls about diseases. If you asked me a month ago what was our number one call, I would have told you calls about children getting into household chemicals. Today, those calls are sort of minimal compared to number of calls that we're getting on COVID virus, resources for COVID testing, problems with access to care about COVID and such. So I can tell you that we are now answering almost 300 to 400 calls just about COVID virus and resources in the state, as compared to for every 10 calls, we get one call about poisoning.
Yeah, that's interesting because I heard it through the grapevine here in Tampa, our major medical center that's here, which is a poison control center, that they've been receiving a lot of phone calls because of COVID-19 also. So that must be a national thing then for sure.
It is, it goes state by state and sometimes county by county. But, when the state asks, we are partners with most states and CDC and also Health and Human Services. So when we are asked to step in and help, we usually jump in. And because of our history of being able to not only answer these calls, but respond to the surge, and because we have had planning for disasters and such, it's sort of the states really turn to their poison centers in times of need. And we try to meet every request when there is a pandemic or epidemic going on. Although that's not the usual focus of poison centers, we have never turned down, any type of a public health hazard that they asked us to get involved and disseminate information or help the public understand what's going on.
Yeah, and there's something else about poison control hazards that probably most people aren't aware of, that there's different hazards based on seasonality. Certain hazards are more common in one season than another. Dr. Shirazi, can you talk about the differing hazards seen depending on the season of the year?
Well, of course, I live in Arizona, and in Arizona, we are either, you can say, cursed or blessed with variety of animals, including, we have the only scorpion that's neurotoxic, in the, Americas, North America and United States. We also have a variety of rattlesnakes, and of course, during the warmer season, both because of increased activity of these animals and also because of our population going out. We're now in the spring. Arizona's weather is really good. Everybody's hiking. Everybody's going out. Everybody's trying to picnic. And even with COVID, because people can't go to restaurants and gatherings indoor, outdoor activities, which are usually singular, are much more common. Our season, actually snakebite season, starts in March and goes all the way to the end of September. So seasonality of snakebite, exposures to scorpions, and of course, mushrooms, for example, it's another one. We also have Gila monster, and Gila monsters they're lizards that they have a venom, and they tend to come out right after our rains toward the July and August. And again, they are very beautiful animals, and people are outside and hiking or walking, and they interact with these animals, and they get bit. We have problems with the bee envenomation. As you know, our country now, we have lots of what is colloquially called Africanized bees. These
Right.
were hybrided bees that escaped actually labs in South America, and by about 30 years ago, they established colonies in the southern U.S., and now they go almost up to the Canadian border. And in the summers, especially spring and summer, we see lots of bee envenomation, massive bee envenomation, and on occasions we also see unfortunate deaths. People who are hiking, they're outside or climbing, and they disturb a beehive and they get attacked. So yes, seasonality, especially with envenomations, mushrooms, plants, are well known to us. And of course, when you go indoors and during the winter season, medication exposure also increases because people are interacting. They usually have some sort of a cold, flu, or something, and lots of medications, over-the-counter medications, are sort of available at home for the variety of reasons, and children can get into them, or people get exposed to them inadvertently.
So, Dr. Shirazi, if someone needs to find their local state poison control center, is there a quick place to find the contact info?
Yes, we actually have a national number that's been assigned to poison centers. So the number is 1-222-1222. So 1-800-222-1222. So it's a palindrome of twos with a one in the middle. And that's the number that one can call. Now, that number is attached to your area code of your phone. So I always give an example that if you're a New Yorker with a New York area code and you call that number because of a snake bite, you don't get Arizona's poison control. You get, because of your phone area code, you get the New York Poison Control Center. Fortunately, we have the relationships that they would say, okay, what's going on? And fast they would call us through the backdoor numbers and connect the individual to the state or where they are, the type of care that they need. But yes, there is a national number, and anytime you go on your phone, on your computer, you can put poison center, and your local poison center usually pops up. You can put the name of the state and the poison center.
Very good. Now, as I said in the intro, this week is National Poison Prevention Week 2020. Can you talk about the importance of this week?
Yes, I would tell you, this week was established by President Kennedy, and it has been sort of a showcase to bring to attention of the public the dangers associated with chemicals and medications and variety of exposures, whether it's plant, whether it's a medication, whether it's a chemical used for cleaning or chemical that's used as bauxite. And I would tell you up till a month ago when we started seeing the first cases of COVID, and still to this day, one of the top killers of Americans due to a non-intentional exposure is actually exposure to medication, which is known as opiates or opioids. Most people recognize these as OxyContin or oxycodone, and overdoses, non-intentional overdoses that kills many Americans. And they now have surpassed the number of deaths from motor vehicle collisions in the U.S. And this is important that we usually use this week to bring to attention of our public that there are dangers associated with exposure to chemicals and to protect themselves, and how to utilize their poison centers if they have exposure.
Okay, lastly, Dr. Shirazi, any final thoughts on any of these topics that we've gone over today?
No, really, we are, only thing is most people don't know, as you mentioned, what poison controls do. And we are involved in variety and multiple facets of public health. And we are a resource for people, whether you want to know your new medication interacts with your old medication, whether you had a bite or a sting, whether a chemical splashed in your eye, or you have questions about, interaction of some chemical, such as, let's say, grapefruit juice with your medication. We are there, and during times of emergency and epidemic and pandemic, I would say outbreaks, we are there to give you information, up-to-date information. Utilize your poison centers. We are there. We have been put there and been added for tens of years. Arizona Poison and Drug Information Center has been in continuous practice for now 65 years, although officially recognized by state for only 45 years. So these resources are there. It's free to the public, and we are more than glad to help our citizens and our colleagues in medicine, pharmacy, nursing, to take care of patients or provide information to the public that they need.
Well, we definitely appreciate the work that you guys do. And I want to thank you, Dr. Mazda Shirazi, for sharing your time and your expertise with us today.
Thank you, and my best to everyone. Protect yourself.
Thank you, sir.